Hey everyone, today we're going to talk to Dr. Susan Rich. This is something I never knew. She, from her bio and then what she shared about the dangers or unknown effects of alcohol use for children. In order, she'll go into that research, what she does. She's an author, she's a speaker, obviously doctor. And also she has another one. We will have another possibly recording on that where she has an organic and there's a lot of details in there. I don't want to go into that because it's a whole separate show. But right now we're going to be talking about her research, her how she educates people about the dangers of alcohol, not only for women, but on men, which people are not aware of. With that, Dr. Susan, kind of go into your history, your doctor's degree and how you kind of I guess, got into this whole study and educating people about the dangers of alcohol, not only on women, but, when they're pregnant, but on the men, how men cause that issues.
Well, thank you, Raju, for having me on your LinkedIn and YouTube channel. I think it's always great to meet people on LinkedIn, and that's how we connected. And I think just spreading awareness, it doesn't have to be just among professionals. We do need to spread health awareness, as they're saying now, make America healthy again, which I think we could look at that as a political stance, or we could just say in general, that's a good thing to do. Um, so I'll dive in really quickly just by saying I didn't always know about this issue. And I actually, once I found out about it, left a job in pharmaceutical research in January 94
Mhm.
to finish my master's of public health degree at University of North Carolina at Chapel Hill because this issue was so important to me. And
Mhm.
I had already been teaching about it in Native American communities across North Carolina and developing programs with both the March of Dimes and the ARC of North Carolina. But I started really writing a lot of grants and developing programs during and after my public health degree
Mhm.
for women in recovery and their dependent children.
Mhm.
But the issue I found out about, which led to all of this, and then me eventually going to medical school, was the issue of prenatal alcohol exposure.
Mhm.
And what the issue involves, that was surprising to me, is that it affects the developing fetus before most women even know they're pregnant. So it happens as early as the late, uh, from the second week through the third week, the fourth week, when the major organ systems are beginning to form and develop, and especially the central nervous system and brain, which, as you know, alcohol affects all of the systems in the body. And now we're knowing that it causes so many cancers and so many illnesses in people that are adults that consume. But what a lot of people don't know is that 1 in 20 American children are affected by the mother's use of alcohol. A lot of it happens even preconceptually, before they know they're pregnant, I should say, in those weeks before pregnancy recognition. So the CDC is now saying for both men and women to avoid alcohol up to 6 months before they're going to conceive. That means to use reliable contraception
Mhm.
up until you've not used alcohol for 6 months.
Mhm.
And the thing is that most people don't know the reason behind why they're saying that for men.
Mhm.
And the reason is that it takes 3 months for sperm to develop from the beginning of the sperm, which has basically four complements of DNA, to the point where it has half the complement. It divides, and it matures and eventually develops a tail and, all the parts of the sperm, right? And, those little guys have to swim, swim, swim. And you need about 1 million of them bombarding an egg to have a healthy pregnancy. But the problem is if your swimmers aren't swimming right,
Mm.
or you got one with two tails, or you got wonky DNA going on because they've been epigenetically modified by the alcohol,
Mm.
then you're going to get infertility. You're going to get reproductive health problems in the baby as it develops. You're going to get problems. Even low birth weight and prematurity have been linked to the father's use, not just the mother's use. Now, it's true that if, say, the mother uses and the father doesn't, the baby's still going to have a lot of problems. There are serious consequences of a woman's use. But what people aren't being told is that the epigenetic modifications, these are changes to the histone proteins that the DNA wraps around. Those changes are passed from the father's use all the way through the generations for many generations. And so we've known about that problem since the early 1900s. There was a guy named Charles Stockard that did work in fish and guinea pigs and showed a lot of this, that even in the fathers or the grandfathers, say 5-6 generations before, there can be changes in the progeny going forward. I won't get into a lot of his research. I believe he was a eugenicist. That was at the time when eugenics was a really big thing. But what we have to appreciate and understand is that alcohol is a solvent. It is a chemical that really belongs on the shelf next to bleach. We use it in industrial, factories and things like that to clean out, machines and vats. And if you want to sterilize something, you can use alcohol. And it really damages the cells in the body, and it denatures DNA. So if you, even like my early experiences in science was I worked in laboratories to pay my way through college. And I did my undergrad in microbiology from North Carolina State University, graduated magna cum laude, which means I studied hard. I was an honors scholar. I did virology research with a guy at NC State who had DOD grants for his work trying to create vaccines for these bioweapons. He was not in the side of creating the viruses. He was in the side of creating the vaccines. But anyway, so I learned a lot about how to look at DNA and take it apart, and even doing PCR, which is a polymerase chain reaction to get more DNA duplicated, right? And I worked for a while at National Institutes on Environmental Health Science, and there with basically a fruit fly, but we were replicating DNA from the salivary glands to like prove something in science. Okay, I'm just going to put it in a nutshell like that. But we had to denature the DNA from the salivary glands to be able to run it on the agar. And what do you think we used to denature the DNA? We used alcohol. All right. So what do I mean by denaturing DNA? I mean cutting it. I mean making it into little tiny pieces. Well, so then if you kind of look at what it does in our body, it's a mutagen, which means it mutates DNA. It's a carcinogen, which means it causes cancer. And some of the reasons it causes cancer is that it does wonky things to the turning on and off genes. Well, it turns out that the epigenetic component that I was telling you about in sperm DNA, it's not the DNA itself that's affected, it's the histone proteins the DNA wraps around, but there's a little change on those proteins. It's a little carbon and 3 hydrogens called a methyl group that's put on there. And if you've heard of methylation effects, there are a lot of things in the environment that can cause methylation.
Mhm.
but alcohol is a big one.
Mhm.
And so it's in that way, then it's a mutagen, it's a carcinogen, it's a teratogen, which means it causes birth defects. It's a neuroteratogen, meaning it causes neurodevelopmental deficits.
Mhm.
Like, it can be linked to cases of autism, it can be linked to cases of ADHD. And even though these things in mental health are multifactorial, because if you have a baby that's born with certain predispositions to things,
Mhm.
it's just like you might have in your family a predisposition to heart disease.
Mhm.
And you might be at risk for, let's say, high cholesterol, but you can do things yourself starting when you're really young to fix that. Well, the same way with these children that are born, they're going to have early developmental milestone problems, meaning they're not achieving their milestones like talking, toilet training, walking, making good eye contact for some of them, just engaging with their environment. Now, you can do things like physical therapy, speech therapy, occupational therapy to help them. So I don't want for anyone to think that these children cannot be helped, because they can. And just like someone who has autism or intellectual disability from a genetic reason, that's not an environmental toxin like prenatal alcohol, it's from a genetic reason. You can work with those children from young ages, just like children who are born with Down syndrome. You can work with them and get them functioning at a higher level. But the main issue here is alcohol. Now we are being told finally the truth about it in terms of it being a carcinogen, but we've known it was a carcinogen for decades.
Mhm.
It's just that there's a smoke and mirrors of marketing done by big alcohol, Raju. And big alcohol now is able to sequester information that we consume about its product. And unlike other products, which even orange juice, believe it or not, the Food and Drug Administration took on orange juice many years ago, like maybe 2 decades ago, at least 2 decades ago. And they said, if it's not fresh squeezed on the label,
Mhm.
you cannot say fresh squeezed. You got to say it's from concentrate.
Mhm.
Well, why is it then that a beverage so widely distributed and widely consumed as alcohol is not correctly labeled? I'm going to ask you that. Do you know about the label on alcohol?
I mean, I have a whole different, thing about alcohol because I've done some studies. Basically, alcohol kills gut bacteria, which is the number one thing. Issues. I have other questions, but
Okay,
I'm
okay.
waiting for you to
Well,
finish
so that
before. Mhm.
the label is not protective
Mhm.
of the public.
Mhm.
And I feel like the public deserves to know.
Mhm.
And it's just like with cigarettes.
Mhm.
There were 5 states, including Maryland, that took on the tobacco industry in 1980s and 90s. And they sued them and won. And Maryland, the state of Maryland, still gets money from that lawsuit because of people being kept on respirators and ventilators and having to have long-term oxygen because of COPD and other, emphysema, other types of chronic problems from the tobacco smoke, right? And the Medicaid funds that they were drawing down from the federal government did not pay for all of the healthcare costs of those individuals. So they sued the tobacco industry and they still get money. And so you might say, well, where are you going with that? Well, I'm saying unless and until we hold the alcohol industry accountable for this lack of information on the label. So the little label, it says, as far as reference to alcohol and pregnancy, pregnant women should not use alcohol because of the risk of birth defects. The problem is, by the time you find out you're pregnant, it's already too late. Most women, 50% of pregnancies in this country are still unplanned. And most women are not thinking about being pregnant, much less the man thinking that there is a problem with his use. So until we get real as a society that we have 1 in 20 of our American children affected by our social drug of choice, I'm not even talking about these people who are ending up with cancers. Breast cancer is one of the leading causes of breast cancer in women. I'm not talking about grown adults who can make their own informed decisions and do so despite what they hear about. And they don't get help for their condition. And it's because it's an illness, they need intervention a lot of times to help them stop. And people use alcohol for many different reasons. But the truth is, the public isn't being given access to the correct information about this product when it comes to use during reproductive years. And what the label should say is that alcohol consumers should use reliable contraception to prevent fetal alcohol spectrum disorder, and pregnant couples should avoid any alcohol if they are trying to conceive, right?
So that's, yeah, got you.
So couples who are consuming should avoid any alcohol. The CDC is saying up to 6 months prior to conception. So anyway, but yes, you have questions too. And, I'm sure a lot of people have questions. There is a lot of information out there in the, on the internet now, the Centers for Disease Control, which we have to believe them. They have like decades of data on this. The National Institutes on Alcohol Abuse and Alcoholism, decades of data, which is growing dust on people's bookshelves in ivory towers, and it's not getting down to the public. And so what I did is you were asking about my journey. After doing public health school, I worked for a couple of years developing programs for women in rural North Carolina. And then I went to the University of North Carolina, Chapel Hill, and went back there for my doctorate of medicine. And I was given a Board of Governors scholarship. I'm so grateful for that. As a result of my master's thesis, I was given a North Carolina Governors Institute on Alcohol and Substance Abuse public policy scholar grant. And during medical school at UNC, I got an American Medical Association government relations grant to come up to DC for a summer and worked with the National Organization on Fetal Alcohol Syndrome. And that's how I got on their board. And as a resident at Georgetown, after doing my my medical degree at UNC Chapel Hill, while I was a resident at Georgetown, I got nominated to the board of trustees of the American Psychiatric Association, which then led to me proposing with a colleague of mine, Dr. Roger Peel, to have neurodevelopmental disorder associated with prenatal alcohol exposure put in the DSM-5, which we got it in. It's on page 86. And so all of these children now, this 1 in 20 that we're seeing in our country, many of whom come into psychiatric centers and mental health clinics, because around 94% of the children end up with mental health problems. And that includes substance use, early substance use. It includes depression, anxiety. High percentage of them end up committing suicide, believe it or not. It's a really traumatic condition to live with. And there are over 400 non-communicable illnesses, meaning that you can't pass them, to someone else. Like it's not an infectious disease, but it's chronic health conditions. There's over 400 of these that are associated with prenatal alcohol exposure, that the people who have fetal alcohol spectrum disorder end up living with chronically for their lifetimes. And it leads to lost productivity in the workplace. It leads to very poor social outcomes for them. Many of them have difficulty finding employment. Many of them have difficulty graduating high school or going on to college. And it is a variability to it, because there are some people that are highly intelligent who have it. And even George Bush Jr., believe it or not, his mom, jokingly, but she was serious when she said it, said that she drank every day of her pregnancy. And so you could see some of the glitchiness, and I'm not going to, pontificate on that, but, in the way that he spoke and his mannerisms and even some of his facial features. But she was the one who said that on national TV, like it's a joke, and maybe he was spared, but it's people joking around about this when it is a very serious matter. Mm-hmm. And, men need to get real with this too, because if they use that embryo, is way more likely to have serious effects if the mother uses.
Right.
You see, so the combination of the two, it's kind of like a exponential effect.
Got you. Yeah. So let's get into a few questions. We kind of went longer than expected, but hopefully we can spend 10 more minutes to get into a few more questions. The quick question I have is kind of the science. What I heard is, this is from, I think I heard it on Andrew Huberman's podcast. If you know Andrew Huberman, who's a Harvard guy, a lot of into brain research and all, and very health research and all, that alcohol kind of dissipates or passes through the bloodstream, whatever, in somewhere between 2 to 6 weeks or something like that. I forget, whatever. But your research, or according to what you said, it takes even 6 months. So that's one.
For it to do what? Oh, to leave.
To leave your system.
So I think the CDC is making that that sort of 6 months, because it's going to take 3 months for the sperm to develop. Okay. And they're probably giving some type of buffer because, and I don't know why they came up with 6 months versus saying it's going to take 3 months, other than, maybe they're figuring it's, for some people, they're not going to totally give it up.
Gotcha.
We tell people a lot of things in medicine, I have to be honest, because we assume that they're not going to listen to our instructions. Huh. I have to be honest. So as an example, telling somebody that they need to exercise, let's say you got to exercise 5 times a week for 30 minutes. When in fact, maybe for some people, 3 times a week for 30 minutes is fine. Maybe some other people need 7 days a week, 3 hours a day. It's kind of like shooting from the hip. You use as much research as you can. Yep. But to be honest, I think getting the average American to give up any alcohol for 6 months is going to be a little bit ridiculous.
Yeah.
And I think that if you look at how our society is so caught up in every social event, from, I'm saying, tailgating, every major sports event, you go to college, you can't get by without like the fraternity parties and the dorm parties and all that, even high school age kids. And to be honest, there's research showing that epigenetic modifications are happening in people's eggs and sperm very early during their adolescent years by heavy alcohol use.
That's kind of true, right? Let's go to drugs. If you're a heavy drug user on the long term, obviously there's going to be an effect. Same thing with, let's say, tobacco use, right? Again, there's also, questions about, you were talking about alcohol. One of the things, like, for example, wine, what people don't understand is every wine is not the same, first of all, because there's a lot of chemical processing that can be hugely detrimental versus maybe some pure processing where there's no chemicals. Maybe that's a little bit better than alcohol, but alcohol, period. I've quit for something years ago. I don't have any inclination to drink it, but what I started understanding was the best, people don't understand how much alcohol and sugar are so bad for you, your gut, so many things, right? That's beside the point. That I already knew. What I didn't know was it could affect your sperm and the children and all that stuff for a long term, which I don't think people will. I mean, I'm going to guess most people who listen to this will like poo-poo it. Yeah, whatever, right? Because like you talked about everywhere, it's not only US, in India, back home, and I go back, go back and visit. One of the things is I don't meet a lot of friends because the problem is whenever you meet, it has to be an alcohol involved. I don't drink alcohol, so it's like a boring thing for them. So I go for lunch. No, I can avoid the alcohol conversation, and that is very true. Obviously, all these big companies, same with the tobacco, alcohol. I mean, beer, you go with any alcohol, there's a lot of additives there. You're not getting pure alcohol. First of all, pure alcohol is, like you said, it cleans up the system, probably with all the genes and everything, modifying. So that's one thing. So okay, okay, just for FYI for the users or people who are looking, watching this, I'm going to post the articles and the book and various stuff that Dr. Susan has. So you can go look it up. They're like research done. She cited in her articles and all that stuff. You can go look it up. If you're serious about it, if you want to understand how much effect it might have on the kids, that if you're looking to have kids, especially, I would take a look and make sure, hey, you're safe, on that. So
Yeah,
anything.
and the other thing is to look back in the family history, because there are there are families where, say, the grandfather or the great grandfather was the alcoholic, and now you're seeing a child being born with this kind of neurodevelopmental condition that everyone's scratching their head trying to figure out, where did this come from? And I have one patient in my practice whose great grandfather was a heavy alcoholic, beat his wife, terrible situation, and caused lots of trauma for the family. But he has a duplication syndrome, which is de novo. Like, nobody can figure out like where this came from. Like, it means it was never in any other family members. And not saying that that's where it came from, but just trying to figure out, okay, between that and because where the young man is from in the world, there was Agent Orange used when his dad was conceived and developing. And then another one, I can't remember what was the other chemical because it was in Vietnam, what the other chemical was that was used. But again, there's these multiple hits that go on, just like with breast cancer. It's not just the first gene that's the problem. It's like a second hit will then activate some of the genes and cause worse problems than if the gene was silent. So that's another piece to this, that it doesn't have to be the parents themselves. And parents should never blame themselves. What you don't know, you cannot like feel sorry for yourself about. Like, you just have to help the child move past that, instead of shaming the child, though, and telling the child how stupid they are, which I've had parents to do that, and they will make the child feel that they're not smart enough because they're not achieving straight A's, and they're a little slower, getting the homework done, or they get frustrated easily. And the parents then yell at them and belittle them and demean them. And that makes it even worse, instead of being patient. And maybe if you can't tolerate helping them with their homework, finding someone who can, being gentler in your parenting approaches with these kids. So yeah, and honestly, I don't have all the answers. The answers are not all out there. But I think until our society starts talking about this seriously, we're not going to be able to solve this. It's just going to keep happening and happening and happening.
Exactly. I mean, that's the reason, right? Like, I shared with you my, YouTube or part, or used to have the podcast. I took out the podcast, but anyway, it's called Mind Shift to Health and Wealth. The whole point of having a conversation with you is when Wayne Dyer said this, when you look at the things differently, or when you change the way you look at things, the thing you look at changes. The whole point of this is, if you do not know what alcohol causes, not just your own personal health, your potential, children and all, I mean, maybe grandchildren, then you would know, you just would think, hey, I'm just drinking, whatever, it's all fun and games. But if you don't know the potential long-term, obviously there's a lot of research being done and all. But, if there is enough evidence that it causes issue, you better be careful. You better be aware. So that was the whole point. Now, quick thing, Dr. Susan, the best way to get that one more question. Yeah, before I go to the best way to get information. The question I wanted to ask is, are there any tests available right now people can get if they think, okay, I got pregnant, but maybe I was drinking before. Can I test something to see if there's a potential effect there or not? Or there are no tests like that right now available to test the potential fetus?
So you're asking whether there are tests to test the, let's say, child in the womb or after they're born?
In the womb, potentially, so that they can maybe do some remedies or whatever.
Yeah. So unfortunately, only about 1 in 10 children, so like 10%, have the full facial features of fetal alcohol syndrome. Only about 10%.
Mm-hmm.
And the other, say 90%, have neurodevelopmental problems, which you won't start to see until the baby is born and starting to have delays in their milestones and things like that. And even some of them don't even have any delays. There are studies being used to look at meconium staining, and even I think some of the placental proteins and things like that, to see if you can, once the baby's born, detect whether or not the mom used. But honestly, it's really a matter of just the mother understanding that there might have been some exposure, and then being honest, if she can, with the healthcare providers. And oftentimes what happens, even when the women are honest with the healthcare providers, Raju, the healthcare providers will say, oh, it's not going to be anything. It's not going to be, nothing's going to happen. Don't worry about it. You're just worried about nothing. When in fact, years later, when the child starts to school, the teachers notice a lot of differences, and then the child ends up worse because the child didn't get early intervention, which could have helped some. The infants and toddlers programs, which are more like occupational therapy, speech and language, physical therapy, the things like that can really help early on, and just a different way of parenting them, to be on the lookout for some of these differences that will help to get services for, so that they will look relatively neurotypical by the time they start school. And a lot of it is social communication, believe it or not, and their frustration tolerance. Many of them do have mood outbursts, and are just completely emotionally dysregulated. Many have sensory issues. They don't like being touched and things like that. But there's no real way to, kind of do a blood test or anything that
Okay.
I'm aware of at this point. Yeah.
Got you. All right. So I know we kind of are running out of time. Actually, we went over time.
Yes.
But I still have some questions, but we'll probably cover. But one thing I wanted to tell people is, so Dr. Susan has a different project, which we didn't cover because we didn't want to get into those details. We'll do another recording on that, basically about her farming and how she helps kids through that. A lot of information to cover there, so we'll leave it alone for now. But on this, Dr. Susan, as I said, I'll get all the information from Dr. Susan that I can post about any scientific papers, whatever, with these recordings and clips I'll be sharing. I'll try to share as much information. She has a book, bunch of research papers, lot of information. Let's say she has a lot of information, so you can go check it out, understand, what she's talking about, understand for yourself, and maybe share it with others. That way, people are aware of alcohol, and maybe especially if they want to are wanting to have children, be aware. So to look into her information. With that, Dr. Susan, I normally ask the last three questions, but we'll cover that on the next one. So we'll cover that topic on the next one since we went long on this one. Anything else you want to kind of share quickly for people on this topic?
No, thank you so much for your time. If they are interested in getting a copy of my book, it's prenatalalcoholexposure.com. So all one word, prenatalalcoholexposure.com.
And I'll be posting that info. I'll be posting the link to the book and all that stuff. So
Thank you so much.
yeah, you can see that with the clips and in the YouTube channel, essentially when I post it. So awesome, Dr. Susan. Thanks for talking to me and sharing this information. And we shall talk again for the other topic we'll cover in the next one. So
I look forward to that, Raju. You take good care, okay?
you.
Thank you.